the Ministry of Health, and I'll ask Phil Grady to introduce himself.
Good afternoon, Philip Grady. I'm the National Director for Mental Health and Addictions at Health New Zealand.
Today we are publishing a report following a formal regulatory inspection into Canterbury Waitaha adult inpatient and forensic mental health services. I will be making some brief remarks and then we'll provide time for you to ask questions. We expect to finish at around 12:30 p.m. As many of you will be aware, this report has been some time in the making. In 2022, the tragic killing of Leasa Walker by a former special patient under the compulsory treatment order at Herald Hospital prompted an independent review into the incident commissioned by Health New Zealand. Separate to that review, as Director of Mental Health, I believed that the public needed to be assured that the mental health services were complying with legal requirements and that any systematic issues were identified and being addressed. That is what prompted the formal inspection under Section 99 of the Mental Health Act. While undertaking this report, tragically there was another second murder in 2024 by a former special patient at Herald Hospital. This has also prompted a separate review by Health New Zealand. The findings and recommendations of my report are relevant to both incidents, but my inspection did not review the specifics of either of those two cases. One key thing about today's report: it is written primarily for a mental health service audience rather than the public. Having said that, it is on our website and it is available to the public to read. The report is designed as an important input into local mental health services to help them ensure local services work as intended in keeping those in care and the public safe. My report sets out 9 key findings detailing the accumulating legacy impact from the serious earthquakes, the Canterbury terrorist event, and then COVID-19 pandemic. Critical staff shortages, poor morale, disruption and delays in resourcing decisions, these contributed to pressures all inpatient services and many important aspects of care. The report sets out 18 recommendations for Health New Zealand, grouped under the 3 key themes of governance, model of care and resourcing. These are critically important for ensuring services are well led and well directed, that the staff working in the services are doing the right thing in the right way, and that the services are appropriately resourced so that they can do that job well. When governance, the model of care and resourcing are all operating as they should, we have services that are effective and are as safe as any other similar services in similar countries. Lastly, both Phil Grady and I met yesterday with the Waka Tūnadea family, who have been very sadly affected by one of these tragedies. We gave our heartfelt apologies for these tragic events and expressed our sorrow for what had happened to them. We provided them with my report and talked to them about the efforts by Health New Zealand to make a series of significant improvements to its services and how we will continue to support them. This progress is continuing. To maintain the momentum the report recommends, and Health New Zealand agrees to, 12 months of continued reporting and monitoring so that the Ministry and the public can continue to see the progress being made in these critical, important areas. Please note that the 2 independent reports commissioned by Health New Zealand into the 2 tragic events are now part of the coroner's investigation, which will limit both what the Ministry and Health New Zealand are able to say about them. We're now happy to take questions.
The family of Faye Phelps, they have said that it was a real tragedy that it's taken so long for this report to come out, and that they do think that some of the recommendations and changes we made earlier that may have actually saved their mother's life. What do you say to that?
What I can tell you is that while I was doing the Section 99, I was also providing feedback to Health New Zealand, and Health New Zealand were already starting to make significant changes. The changes that they have continued to make are recognised in the report and in the appendix to the report, and the recommendations are aimed at trying to ensure that those changes are fully embedded.
But when will those happen? Can the public be reassured that the situation is actually safer?
Look, thank you for your question. Look, I first want to make a couple of comments. Look, part of the reason that we are here today is because 2 people have tragically died in the Canterbury community. And I just want to acknowledge Lisa Walker, and I want to acknowledge Faye Phelps as members of families, and this is an absolute tragedy. I also want to say very clearly that I am deeply sorry that these events have occurred. Health New Zealand accepts that we have made some failures in terms of the delivery of our mental health services in Canterbury. We accept Dr. Crawshaw's Section 99 report and recommendations in full, and we also accept that the changes that have been recommended to be made by Dr. Crawshaw's report are sustained, and we welcome Dr. Crawshaw's independent assurance and monitoring over the next 12 months to ensure that those recommendations are sustained. To your point, and your question was around could have this been avoided, I don't want to get in front of the coroner's inquiry, but I accept and understand that families will have questions and they want answers to those questions. And as Dr. Crawshaw said, I have personally met with the Rocket Tunado family yesterday, and I've been able to talk through some of the questions, the detailed questions that they have asked. In addition, I have reached out to the Phelps family through their representative, and at the time that's right, I'm happy to have that direct discussion. My final comment is that we haven't waited to make changes. We haven't waited, so I think that's behind your question, haven't waited for the Section 99 report to to be released today. We moved to have an independent review of the services back in leading on from the the 2002 June event. That identified similar areas that Dr. Crawshaw mentioned, and it's fundamentally, which is included in the report, staffing levels, resourcing, clinical governance, leadership, and making leave decisions. Finally, you'll see in the report that Dr. Crawshaw's report shows there has been progress, and I'm pleased that there has been progress. But I also don't want to lose sight of the reason that we're here today, which is the tragic loss of 2 people in our community.
You mentioned that you went and met with one of the families yesterday.
Yep.
Can you tell me what their reaction was to the report?
Look, personally it was one of the hardest meetings I've ever been to. I've apologised to the family and the families. They're processing, and I don't want to talk about, and I committed to them that actually the conversation we have had would be an honest conversation, would be a truthful conversation. I think it's fair to say that they have been through significant trauma and they're still trying to understand the events and what happened. The commitment I've made to them is to continue to meet with them and work through that. In addition, Dr. Crawshaw has made a commitment to that family to actually share progress against the recommendations in his report. My view is they want to ensure that this doesn't happen again.
And so one of the key issues that was brought up was about the shortage of staffing.
Yep.
And the flow-on effects of that. So how has that changed? Is that in a better situation?
Yeah, so it is in a better situation. And look, for mental health services, staff are our tools. And we recognise that at the time of the review, particularly in the forensic mental health services, the staffing numbers weren't what we'd expect them to be. Since the review, the staffing numbers in the forensic mental health services have grown by 11%, and across the whole of the Canterbury Specialist Mental Health Services by around 6%. Notwithstanding, actually, there is a shortage of mental health workforce internationally, and specifically in the area of psychiatry and forensic psychiatry. We are looking across the country around how we might grow that pipeline, and also looking at how we might support the forensic mental health service to make sure they've got good clinical support for psychiatry.
Why did it take 3 years for this report to come out from 2022 to now? What was the reason behind that?
Well, John, I might ask you to make some open comments.
I'll make some open comments. In order for me to be confident in some of my findings, I was looking for further information, and that took some time. If you read the report, there was also the challenge of some of the people I was relying upon dealing with the disaster situations, which further slowed things down. And so, but when I actually was speaking to the leadership team, I gave them initial feedback and have been working with them. I think it's important to know that what's critical here is that the services are brought to an appropriate standard. So for me, the Section 99 is just not about a report. It's about working with Health New Zealand to ensure it's implemented and that the changes happen and those changes are embedded. We've had very tragic losses which I'm sure everyone can understand actually causes immense pain, not just for the families, but also sometimes for the staff who have actually been looking after individuals. And we need to make sure that they and the public are assured of safe, quality services.
Can you sort of outline what you found with the staffing issues? I think they talked about the fact that there was a real intense feeling that some of the staff, of how stressed they were. What did you find?
I think I made a commitment to the staff at the time that I would keep what they said to me confidential, because I wanted to encourage an open and free-flowing dialogue with them. And I did my best to try and triangulate the situation across multiple staff groups, lived experience, various groups up and down. And I think that the key thing was that we've got very skilled, experienced staff who come to work every day to do a good job and to provide good quality clinical care. If you feel unable to do that, which some of them were saying to me, then that causes immense, not just stress, but also personal, emotional feelings about that. That's why I've made some of the recommendations I've made, because it's important that those staff are supported, that they have appropriate resourcing, and that they are appropriately engaged from the shop floor through to senior leadership and back again. So the recommendations are addressing their concerns.
John, can you guarantee today that enough changes have been made that this couldn't happen for a third time in Canterbury?
I think that what we see with respect to the changes that Health New Zealand have been putting in place is that they have been putting in place what I would expect after many years in this business, that a specialist mental health services need to do to ensure safe and effective care. Specialist mental health services deal with some of our most distressed and distressing individuals whose behaviour is always challenging for staff to deal with. When we have the right processes, when we have the right policies and the right staffing and the right leadership, we can assure the public that the service is as safe as it can be. What I am seeing is that Health New Zealand have taken on board the early feedback and then subsequently some of the reviews they've done, and are actually implementing what I would expect them to do to ensure the services are safe.
So it's still a work in progress, it's not as safe as it could be yet?
I think that they've focused on making the changes that are necessary to ensure immediate safety and to ensure enduring safety. However, I'm not prepared to just sit there and say one and done. That's why I'm doing the monitoring program to make sure that they are embedded. Phil, do you want to make any comments?
So a couple of comments. And look, your question goes to public safety, and what I can say is, and particularly as it relates to the June-October 22 case, the fundamental issue that's highlighted is around how leave decisions are made. How does the clinical team manage those risk and making good clinical decisions? Now, I agree with John that there has been significant improvement in terms of that clinical decision making. What Health New Zealand has done is we've put in place a weekly audit of all of those leave decisions. So weekly, those leave decisions are being audited, and that is as close as possible to when those decisions are making, and that being independently audited. In addition, Dr. Crawshaw will be reviewing those decisions independently of Health New Zealand to ensure that the right decisions are being made.
Before leave's permitted?
Sorry?
Before leave's permitted, or...
Do you want to talk about that, John?
leave?
Yeah.
So, just want to talk about two different populations so that you understand. Forensic services deal with people who are what's called special patients. These are people who have been determined by the court to be needing to be treated in hospital. And then the forensic services also have a population of people who are under the Ordinary Mental Health Act. The first group, actually, I already approve leaves. They come to me, I have to give the leave, they have to make the justification for the leave, they then report to me about how that leave meant. And so that group, which is the special patient group, are already having leaves approved by me or my deputy, i.e. from my office. That's required by law, and we do that very carefully. A lot of documentation flows to me for that. For the second group, that is the responsibility of the responsible clinician. However, they still have to have the leave plans, they still have to make that in advance, and they are the leave plans that I will be reviewing. And in fact, we put 2 layers of review in place. The Chief of Psychiatry will also be looking at those leave plans, and then I will be looking at those leave plans. What we know from the audits that have been done is that they're doing those properly now and actually are doing their job well. So this is just the additional layer of protection to assure the public. And once we've seen that happen successfully, then we'll go back to it being within the service. But at the moment, I'm overseeing it.
Given the significant failings found in the report, how confident can the community be in our local mental health services moving forward?
Thanks, John. Look, again, this goes to public safety and also sits within the terrible tragedies that have happened. I met with the clinical teams for 2 of the services this morning, and I've met with the executive leadership team of the mental health services in Canterbury yesterday. From my conversations with them, they are certainly deeply feeling the impacts of the tragedy themselves as well. I am confident, and I know this has been reinforced by the Section 99, that there has been progress made. And the progress made, which, to the public safety question, goes to the right resourcing of staff, the right clinical decision making and clinical governance, and as we've talked about, good assessment and good sound processes around leave processes. That is the right recipe for public safety. Also acknowledge that in June 2022, that those weren't in place in a way that is robust, that's reflected in the report. They are now in place.
The report, so it is pretty highly critical and highlights some real sort of failings there. So has anyone resigned or been asked to?
Look, your question is about accountability. Who's accountable for this? Look, I stand in front of you. I accept, as the National Director for Mental Health and Addictions, and on behalf of Health New Zealand, I accept the recommendations and accept that there have been failings. My job, and that is the commitment I made to the Tūnado family yesterday, is to see through the recommendations over the next year and there onwards. That is what we'll address and lead through what we need to do for this mental health service.
But does it highlight an issue that things had to get so bad before there really some momentum started to actually make those changes, that it was allowed to sort of get to that stage?
Yeah, look, again, your question is about how we as a mental health system or a system learns when there are signs that things may not be going well. And it's fair to say that Dr. Crawshaw has highlighted in his report that there were some signs that things weren't going well, and that led through to the events. What I am confident about is that the service has increased their quality safety staff and actually the whole of the South Island in terms of their quality safety and monitoring in place following these events. What I'll also say is they've increased the support going into the forensic mental health service by way of a clinical nurse educator and nurse leader. So we've learned, but the important thing is that, as I've said earlier on, that is sustained and we continue to operate good, sound clinical quality processes.
Do you have any concerns that there might be similar issues in other parts of New Zealand that aren't being looked at yet?
Yeah. So again, your question goes to, is what's happening in Canterbury reflective of the other services in the country? So what myself and Dr. Dale Bramley, the CEO of Health New Zealand, have implemented is an audit of the leave decisions across all of our forensic mental health services nationally. That audit has been peer reviewed by an independent forensic psychiatrist, and based on the information that we've had back and seen, is that actually they are following the leave policies, and the things that you would expect, as we've spoken on, are in place. Good clinical governance, good clinical decision making, and review pre and post those leave processes.
The report outlines that staff morale was down. What support will be in place for staff who might be feeling overwhelmed after working through these conditions?
Just hold that question. I'm going to have a glass of water, please.
Perhaps while he's getting a glass of water. That's one of the reasons why we met with the staff today, because we realised that this report could have an adverse impact on staff morale. Something which was to my fore in my mind throughout this process was that we wanted to make sure that systems and processes were focused on, rather than actually turning it into some sort of blame game with staff. We depend upon them doing their job well every day, making very, very challenging decisions. And they, I can tell you, get distressed when things don't go right. That's why the system has to have processes in place to learn from adverse events and to then implement those adverse events. What I am seeing is that here in Canterbury, they are doing that.
And just a couple of additional comments is that, this is about staff welfare. This is about how we have, the people that are working in our mental health system feeling the best they can every day. As I mentioned earlier, the Section 99 review has been very hard for them, and the two deaths, two tragic deaths, have been very hard for them. It was important for me to meet with them directly today, with Dr. Crawshaw, to hear their concerns and the things that they're worried about. The commitment I have made to them, and Dr. Crawshaw has made the same commitment, is that we will keep engaged and working with them over their journey. And again, to the earlier point, to make sure that we're making sure the resources are on the ground and the right structures are in place.
And just clarifying, those resources would be available to staff.
And we've got EAP and those types of counselling support. My experience, having worked clinically for this clinical area, is the teams are really tight, and they work a lot in terms of supporting each other and actually working. And in fact, in many ways, it's the Canterbury way. How do you come together through adversity? And my sense is that whilst the team are feeling it, they are coming together, the leadership team coming together. There are some jobs to be done, and we recognise that, and we'll be looking at what additional support we can provide. Look, I think that looks like us. Look, I just want to make just a couple of final comments, and John may look. Firstly, thank you all for being here. And look, this conversation is on the back of a terrible tragedy, 2 terrible tragedies, and I just want to again to acknowledge the families that have been impacted. I also want to reflect on my discussion with the Trinidad family yesterday and what an incredible, courageous family they are and the journey they are going through. We acknowledge that we have some work to do, but I also want to reflect the staff and the incredible work that staff, not just in Canterbury Mental Health Service, but across our whole mental health and addiction system, does every day, are working very hard to provide the best possible care for people with mental health challenges across the country. So thank you.
My final comments are very brief on. We've had some tragic events and we have people grieving and hurting, not just the families but also others who are affected by those. It is incredibly important that the system knows about that and learns from it. I don't do a Section 99 lightly because I know the possible negative impacts, but I can say that Health New Zealand has accepted the Section 99, my report, which, as you've noted, is quite confronting in parts. But more importantly, they've put in place steps which can assure the public of their safety, more particularly the safety of the people who come in expecting good quality care and ability to move on. Thank you.
That's all.